So the GM Care Record enables frontline health and care staff to have access to the relevant clinical and care information of patients.
The primary purpose of the care record is to allow care providers to see the data of the patients that they treat. So for instance, a doctor at the hospital would be able to see the full care record from primary care of the patients that they are seeing.
If anyone's been to hospital, you'll know that ask you questions that your GP would know the answer to. You need to repeat things over and over again. So the care record brings together this information from different sources, and it allows clinicians to give a much better standard of care to patients.
So you might wonder why this doesn't exist already. Well, it has existed in various forms in different parts of Manchester for a number of years, and some areas have been more developed than others. But what those areas haven't done up until the last 12 months is share information across boundaries.
The GM Care Record is really important. We've increased the number of patient records on the GM Care Record from 2 million patient records to 3 million patient records. That's 100% of GM residents now having a record on the GM Care Record system. We've also enabled access to the care record from all clinical settings. From a patient perspective, it really means that irrespective of where you go to receive care, you tell your story once, because the clinician that is seeing you has access to all your clinical information at their fingertips.
Having access to that information really helps me as a consultant to be able to make a timely diagnosis and to sort out an appropriate management plan for the patient.
It's fair to say I probably don't work a clinical day without using it. I think it has been so helpful to us in managing our patients day to day.
My husband's had 2 episodes now of a condition called delirium, which is really a medical emergency. More recently, we've had another near miss with delirium, but it was already there on his record, so when I rang the GPs, they were quick on it, and we got a face-to-face consultation within 2 hours, and were able to avert hospital admission. So it's that important, and it makes that much difference to somebody's care.
So research is different from direct care in the sense that we never look at individual patients. So we don't see anything that would identify them. We only see what they had, so for instance, whether they had COVID-19 and what happened to them.
I lead a team of, we call ourselves research data engineers. Researchers need access to data from the care record, but in order to do that, they need a team of people who can get that data for them and prepare it for them so it's ready for them to go.
So there exists a governance process to decide who gets access to the data and to what data specifically. So the data that researchers see is actually quite limited.
So I'm really passionate about digital developments in healthcare, and we see the GM Care Record as a foundation on which we can build more innovation to make care better for patients and families.
As I get a little bit older, I'm aware that at some point I'm likely to be a patient, and I suppose I wish the doctors who are looking after me in the future to be able to have the same access to my records that I benefit from when I'm treating a patient.